Good morning, everyone. Welcome. Thank you for waiting. Apologies, we're a couple minutes late, but thank you for being here. So lovely to see wonderful smiling faces. Welcome to the informational session for the ODDS Quality and Compliance Administrative role. This session will be recorded and later shared with the participants and future candidates. We'll get started with introductions and then the agenda for the info session today. First introductions, before introductions, we have ASL services as well. So I'm gonna pin Melina here. Thank you so much for being here. Okay. For introductions, my name is Surbi Singh. I use she, her pronouns, and I'm an executive recruiter here with Oregon Department of Human Services and also the recruiter assigned for this role. I'll pass it over to our ODDS leadership team. I'll start with Dana.
Thank you, Surbi. Good morning, everyone. Thank you so much for attending today. My name is Dana Hiddle. I use she, her pronouns. I'm the interim director of the Office of Developmental Disability Services. And I'm joined today by Darlene O'Keefe and Amber Padilla. So either one of you who would like to introduce yourselves, feel free.
Good morning, I'm Darlene O'Keefe. I'm with the Office of Developmental Disability Services, and it's nice to see some familiar faces. I am in the interim deputy director role. Welcome.
Good morning, I'm Amber Padilla, she, her pronouns, and I am the Chief Operations Officer for ODDS. Thank you for joining us this morning.
Thank you so much. With this, our agenda for today, we'll ask our leadership to enlighten the attendees on the vision for this role, what the day-to-day life would look like, the overall responsibilities, and how this work aligns with ODH's vision, purpose, and its work with community partners and case management entities. Then we'll dig into more about the recruitment timeline and process, and then we'll open it up for Q&A. Feel free to put your questions in the chat as well. I'll make sure to answer it over there. If not, then we'll address it as we proceed in the info session. With this, Dana and leadership, please share your vision for this compliance, quality and compliance administrative role within ODDS.
Absolutely. Thank you so much for that, Surbi. So I've been in the interim deputy role for a little over a year now, basically about a year and 4 months or so. And part of what I was tasked with was to create a new structure within the Office of Developmental Disability Services that had essentially pillars. We call them pillars because that is what supports the program. So they're not silos, they're pillars. But really to create an executive structure that had accountability across all portions of the business that we do within ODDS. So we've created these 3 pillars, one of which is the quality and compliance pillar. The other one is the programs and policy pillar, which Darlene leads, and then the business operations pillar, which is what Amber leads. And the quality and compliance administrator position is actually a new position within ODDS. It is essentially a deputy level position within ODDS overseeing the quality and compliance pillar. Underneath the quality and compliance pillar are functions such as licensing. It's actually licensing, certification, and endorsement. We have quality assurance and quality improvement. We have the assessment unit. And so this group is really responsible for the safety, oversight, and quality of all of the services that we provide throughout ODDS in license and certified settings. So settings such as 24-hour residential homes, adult foster homes, children's foster homes, and so on. There are definitely more. And so what this role, the vision for this role is really to lead that pillar. We're at a time in, our state's budget cycle where we're getting our final budget solidified by the legislature, and the governor's office has the same vision for ODDS safety, oversight, and quality and compliance that the legislature does, which is essentially assuring the health and safety of the individuals that we serve, assuring that providers are well experienced, well positioned to serve the individuals within the Office of Developmental Disability Services, those who are receiving our services, and that we have proper oversight as a state entity of what's happening within the state for these services. And so this will be the main point of contact in the executive leadership team for that pillar. We have a lot of work that's happening right now within the quality and compliance pillar related to our provider organizations, our continuum of care within ODDS, our rules and policies that are governing how those providers operate, how they enter into our system, how they serve folks. So it's actually a very exciting time to be part of ODDS, and particularly in the quality and compliance pillar, because there are a lot of transformative things that are happening within this area of the work. And I'm going to pause and ask Darlene and Amber if they would like to add anything to that I may have missed.
I think that covers it. I think the emphasis at this point is that there will be, there's a fair amount of change that's happening. So there is a lot of new work that will be facing this pillar.
And obviously this position will be the position that will lead the changes and the restructuring, implementation of new bills that have come through the legislature, new assignments, et cetera. So it is part of the executive leadership team. It will be, as I said, responsible for leading the work for this pillar, but it will also have the support of the entire executive leadership team and the managers over whom this position oversees.
Thank you so much, Dana. Can you share about how this work, of course, part of executive leadership, it's very crucial and impacting the Oregonians ODHS serves and this program specifically. How does this work align with and work in close partnership with other ODHS programs, providers, community partners, and the case management entities?
That's a great question. Thank you, Serbi. This position is actually going to be the outward facing position for our quality and compliance pillar within ODDS, which means it will have relationships with all of our community partners. That includes our case management entities, our community developmental disability programs, to a lesser extent, our support services brokerages. It will also have a lot of interaction with our providers, individual providers, and provider organizations and associations which represent our providers. And it will also have quite a bit of contact, collaboration with partnership with our Aging and People with Disabilities program within the Oregon Department of Human Services. They are the entity that licenses and certifies settings for individuals who are aged or have physical disabilities, but we do have cross overlap in our populations. And also we do have individuals with developmental or intellectual disabilities who reside in APD licensed settings and vice versa. There will also be a lot of collaboration and partnership with our partners in Oregon Health Authority and the behavioral health system, Medicaid. Again, we do also have some cross-population work occurring there. We have individuals that have co-occurring conditions, and some are residing in behavioral health licensed settings. And we also have individuals with mental health issues that are residing in developmental disability licensed and certified settings. There will also be quite a bit of interaction with the governor's office, our legislative partners, and broader members of the community, including individuals who receive services.
Thank you so much. With this, any other details that you would like to share about this position, before we jump into like the recruitment pieces and open it up to questions?
I am actually going to ask Darlene to provide some of her insights. Darlene, prior to the reconfiguration of the executive leadership team within ODDS, was overseeing most of the work that was done in this pillar. So I wanted to give her an opportunity to give kind of the day-to-day work that's done and the support that this position will provide to the people who are doing the work within the pillar and also to our community. So Darlene, can you field that one?
Sure, just real quick. Day to day is kind of hard to say because this is a very fluid pillar. There's a lot of work that's going on that requires great flexibility, a deep understanding of how systems work within ODDS and then across ODDS. A lot of the focus one day will not be the same focus the next day. There's a lot of work that has to be done with licensing, and when I say that, it's the volume of what's occurring in licensing that calls for a fair amount of attention. But then we also have the other areas of the pillar, which are they do quality assurance reviews with our case management entities. They work our needs assessment. There's also a team that is focused on the regulatory actions that can be taken with a provider if there are issues. And then there's just the overall quality improvement on how do we continue to assure services are the way we want them for the individuals who are receiving the services or the way that they want them. So it's a very busy pillar. I think actually all of our pillars are pretty busy, but there's a lot of diverse work that's going on. And again, I think if you're expecting it to be a normal day, I can tell you that my calendar changes frequently from meetings that I was supposed to attend to meetings that now have been considered a priority. So again, great flexibility, ability to think on your feet, know who your resources are. That's pretty much the day-to-day for this position as I would see it. And I don't know, Amber, do you want to add anything?
I would probably add that see if I can find the words on a Monday, but that your external relationships are going to be really important. So being able to navigate those in high times of stress. I think that's a really important piece of the job also.
Thank you so much. And thank you, Dana, for answering some questions in the chat. That is helpful. This is a state general funds position. There were a couple of questions regarding this. And just the budget for this pillar, Dana answered that as well. In terms of recruitment, just this position, I put the link in the job posting as well. And once we're done with the info session, I'll share the recording, the position description, the job announcement through Workday and through the attendees here as well. The position closes on June 30th at midnight, and the requirements for the application materials is either your resume or Workday profile, a completion of it, and a cover letter. Please enlighten in those materials how you meet the minimum qualifications and the essential attributes we're looking for in this role. So that there's usually a myth that does a computer or software? No, those go manual screening one by one through each of the applications. So it's important to highlight how do you meet those qualifications and attributes for this position here. I see a question in the chat. Will there be additional staffing within this pillar?
I was actually just typing the response to that. We are coming out of legislative session. And we are expecting, if some of the bills pass that we've been tracking, there will be additional staffing within this pillar. And Survey, I may look to you or Amber for the exact number, but I believe there are about 89 or 90 individuals within this pillar.
That's right.
Yep.
About it.
And so there would likely be more added to that with any additional staffing that we received through the legislature this session.
Thank you, Dana. Next question is, what are key performance indicators used to evaluate the success of licensing, certification, and endorsement processes?
That's another great question. We are actually looking at our performance measures right now to determine whether they're actually measuring what we need them to measure. We do have a couple of performance measures that talk about the timeliness. And Darlene, you may be able to provide additional detail on this, but the timeliness of licensing actions and also as it relates to some of the investigations of potential abuse that have occurred in licensed settings and how long that takes. Can you think of any others, Darlene?
That would be the main key performance measures that, if that's specifically what people are focused on here.
But again, we're looking at all of our performance measures to make sure that we're measuring the right things, we're pulling the right data, and we're getting to what the issues actually are that need to be corrected. Part of this team's view is that we want to know what's not working so that it can be addressed and we can fix it, rather than have performance measures that maybe tell us good news all the time. So we really want to root out all of the issues and correct those as they come up.
Thank you for that. There was an attendee who couldn't attend, but they sent me a couple of questions in the email, so I want to make sure I covered one of that as well. What are the immediate priorities for ODDS Quality and Compliance Administrator in the first few months? How do you envision the role contributing to the team's overall goals?
I'm sorry, could you please read the first part of that again?
No worries. What are the immediate priorities for this role in the first few months, and how do you envision the role contributing to the team's overall goals?
So, as I said before, there's a lot of work happening within this pillar. I don't know how aware everyone is as to what's been happening, but recently the state of Oregon, ODDS, requested a moratorium from the Federal Centers for Medicare and Medicaid Services for 24-hour residential settings in Oregon across the state, and also for standard model agencies, which is an in-home agency provider model within ODDS. That's a 6-month moratorium. Essentially what that means is that we have an abundance of residential settings throughout the state, lots of vacancies, and there is concern that that can create negative outcomes for individuals if they have high needs and they are ending up in a setting where the provider doesn't have the experience necessary to meet the needs of an individual with complex needs. And also it can create issues as it relates to fraud, waste, and abuse. So we're really taking a look at our Oregon administrative rules, which are managed throughout the policy and programs pillar, to assure that we have the proper requirements and qualifications for providers coming into the system. And so that is a big piece of work that's happening within the quality and compliance pillar now. So I think that would really be one of the first priorities of the individual coming into this position, is to see that through, again, with the support of the executive management team and other areas of ODDS who are responsible for the work. There's also onboarding of any new staff that may be coming in from the legislative session. And I'm sorry, I was kind of distracted because I saw Alicia's question in there about recent legislation due to a pop from ODHS, or was it legislation driven by advocates? Will it bring on any new initiatives? And I'm not quite sure to what you're referring, but a big focus of this position immediately will be to onboard any new staff, like I said, and to take a look at the operations within quality and compliance and make sure things are structured appropriately within that pillar. Yeah, essentially just make it your own operationally, and figure out how we can all work together better across the pillars and integrate more.
Thank you, Dana. Just one question from Christian, I believe, about the management experience. Does it matter to the hiring staff if past management work is not very recent, as long as it's the screening does not happen how recent or how further apart your experience was, but if you can talk about your transferable skills and how your past experiences have prepared you, and you've attained the attributes we're looking for this role, that would be helpful as we screen the applications received. So thank you for that question. Another question what are the current challenges in aligning efforts between ODDS and partners?
So I would say, and I'll ask Darlene and Amber to for their input from their perspectives as well. I think when you have programs across the state, disparate programs across the state that are operationalizing very similar services, such as within aging and people with disabilities, behavioral health, it gets a little challenging as it relates to the rules that govern each of those programs, the qualifications of providers, the funding sources. And so really trying to work together so that we can create consistencies and efficiencies where we can, so that the ability to access these services and these settings to the individuals who need them is as seamless as possible. So I would say from my perspective, that's probably the biggest challenge. I don't think that there's a lack of will to do better and to collaborate more. It's just, where can each program give a little bit in the way that we've always done things to make sure that we're all working together so it's easier for the individuals that we serve. Darlene, Amber?
That's exactly where I was going to go, Dana. And I actually think it's a very exciting time, because I have seen a fair amount of interest in collaborating with our internal ODHS and OHA partners. And I think that that's also sparked some inspiration with our community partners, like our providers and our case management entities. So it's challenging, and it's going to be a lot of work, but it is definitely something that I think we all would like to see for Oregonians across the state.
Amber, did you want to add anything?
Nope, I think they got it. Thank you.
Awesome. What is the vision for ODDS in the next 5 years, and how will this position help ODDS succeed? What is the #1 priority for this pillar? What is the teamwork culture of the pillar?
So I think that we're all aware of what's happening at the federal level as it relates to Medicaid funding, as it relates to immigration, as it relates to all sorts of things. And I think for the next 5 years, the focus of the ODDS is to manage the program as efficiently and effectively as possible, trying to maintain as many services as we currently have. It's really to keep things whole in this environment. And if we do find ourselves in a situation where changes have to be made, to really work with our community, the people that we serve, the people who serve them, to assure that we're getting it right and we're doing the least amount of harm possible. We're always hoping for the best, but planning for the worst sort of scenario. And I think that really that's where we're at right now. We're at the end of our legislative session again, and our budget cycle is going to be starting again July 1st. And it looks like we currently have enough of our resources to keep our current service level. The folks that we're currently serving at the level that we're serving them with some inflation, some growth in that. So that's really good news. So it's really, finishing up some projects that we've been working on for a number of years, like the redesign of our individual support plan, working on our rules for the licensing and qualifications of providers, working on a new case management system, which is under Amber's purview. So there are a lot of things that we sort of need to wrap up within ODDS to take us into that next chapter while maintaining everything as best we can right now in this uncertain time. So, and I don't know that I hit all the points on that.
Sorry, the question was directly sent to me.
Oh, okay.
I think mostly, yeah, what is the teamwork culture of the pillar? So,
Oh,
yeah.
I will be totally honest here. This pillar has been through some changes, some pretty significant changes over the last probably 2 years. It's been without consistent leadership for quite some time. We've had interim people in interim roles, and part of that was because of how the structure of the pillar was. We did not have, again, an executive level team leader over that pillar. So creating this position really is to solidify that structure and make sure that there is adequate management oversight and a continuity in all of that, and also to assure that everybody knows what their roles and responsibilities are, what their line of reporting is. So I think the culture, we just really need to be able to have somebody who's very solid and dependable, who can come in and help people through some of the, I know this word gets thrown around quite a lot, but some of the trauma of having not had a lot of stable leadership over the last couple of years. So I think it's really just continuing what we've been trying to build and really providing the focus to that pillar that it hasn't really had.
Thank you,
Darlene,
Dana.
Amber, anything?
I'll jump in and say you kind of touched on it, I think, Dana, but I think one of the exciting things coming up for all of ODDS is 2 new IT systems. And I think both of those IT systems are going to have a big impact on the compliance pillar. It's a case management system and it's an agency provider system. And so I think over the next 5 years, looking at how we do things with tools, technical tools that are going to make some of the work easier and require a lot less hoops to jump through, I think will be one of the fun parts about the upcoming 5 years, is looking at new business processes to do that.
Thank you. Next question is, can you please share a few challenges you anticipate this role will face early on? And I think I'll throw in about like what would the onboarding plan would look like, along with the support and any challenges you think this role will have.
I think anytime that you're coming into a brand new position, there are challenges with that in creating the structure that you want as a leader, and setting the culture and the tone of the program. Again, I think as it relates to the work, it's going to be the challenge of the moratorium, assuring that those rules are in place. What's happened is part of this moratorium is that the federal government has told us that all of the existing applications that were outstanding prior to the moratorium going to an effect needed to be closed out. So we closed approximately 400 applications by June 2nd, and we're anticipating that those providers who had their applications closed will be reapplying in December after the moratorium expires. And really, it's up to us during that time to make sure that we have the rules and the qualifications in place that allow us to not get into the same cycle that we've been in, where We have an abundance of providers enrolling, and it may not be the types of providers that we need in the continuum. So 24-hour residential is really our highest level of support for all intents and purposes. And we really want to assure that people within the DD community have access and choice as it relates to other types of settings. So I think that's going to be the big challenge there. And also just learning the job, learning, the structure within ODDS, which of course the team will obviously be present and helping to onboard and teach and things like that. But we do have a somewhat different structure within ODDS as it relates to our licensing, certification, and endorsement of provider types. So really just learning the structure again and immersing themselves in the community, getting to know our partners, learning who's who in our community developmental disability programs, our provider organizations within the agency and outside of the agency as well. Darlene, Amber, anything to add to that? It's a very big, very important role. As the person that's responsible for the operations of the quality and compliance pillar, which oversees thousands of provider organizations, individual providers, et cetera. It's a critical and important role. And so I don't want to dismiss this as this is going to be an easy job, or this is definitely going to be a challenging job. But it's a job that absolutely makes a huge difference in the lives of the people that we serve, because this is the executive that assures that the providers are well qualified and well positioned to serve folks. And if that's not happening, this is the position that also jumps in and helps to problem solve and solution and assure health and safety for very vulnerable individuals.
Very nice. Thank you, Dana. Alicia has a clarifying question. It says, what bill any new staff would be brought on? Was this an ODHS ask to fund more positions in the budget, or was the new FTE from a new mandate from a policy bill?
So the agency did put forth a policy option package. About half of our licensing and certification team were on limited duration positions, which were set to expire June 30th of this year. So that would have cut our licensing and certification team in half. And so part of what we've proposed through this policy option package is to make those positions permanent, so that we can hire permanent individuals into those positions, and we don't have to worry about losing half of our licensing workforce. Which was really critical, because you lose half of your licensing workforce, we wouldn't be situated to be able to do the work we're currently doing, let alone any new work that may be coming in from the legislature. So that one is looking positive. That was included in the ODHS budget coming out of the subcommittee on Human Services, Ways and Means. So we're very hopeful that those positions will be made permanent. We'll be hiring for those. There were a couple of other bills that are currently in play in the legislature that would add some additional staffing to the quality and compliance pillar for additional work. And we're monitoring those closely, so should know in the next few weeks. But I think at maximum, it would probably add maybe 20 to 25 more individuals within the licensing at maximum. And that's probably on the high side.
Thank you, Dana. Before you go into other questions, can you talk about because as we advertise in the position that we're looking, like some of the work can be done remotely, but there are certain requests and certain meetings that have to be attended in person at the central location in Salem. Can you talk about the priority of either onboarding the new staff and coming to Salem when business operations require?
Yeah, so it's really, so again, in the interest of full transparency, one of our interim individuals who was leading this pillar prior to retirement was doing it from the state of Alabama, which did not work well. So when you are in an executive level position, I think it's really critical that you're available when necessary. We try to get together and meet in person at least once a month. And there are times where we have to have people come in, within a moment's notice. Poor Amber recently during the legislative session had 2 hours notice to come in and testify, or actually be in the room with the potential to testify before a committee. And so it's really important that we have somebody that's available and flexible enough to do that. And also with this position, because it is a critical position as it relates to health and safety, there are times when we've had management responses to certain situations occurring in different areas of the state, or different homes, or different settings. And so having that availability is really important as well. I believe that a lot of the onboarding for this position can be done remotely, but there will also be some elements that have to be done in person. And I think a lot of that too is around building the relationship with the executive team. And quite honestly, doing it remotely is not ideal. So a good portion of the onboarding will be in person too.
This is helpful information. Thank you for sharing that, Dana. Another question is, are you looking for someone with past APD experience, or does that matter?
That does not matter.
No. Okay, next question. How are current, we did talk about the onboarding process, so I'm gonna move on to the next one. How are current compliance reviews done for these programs? Home visits, desk audit of branches, facilities, or homes?
I would say all of the above. There's a lot of on-site licensing reviews that are done. There's a lot of desk reviews that are done in the application process. We also have a process through which providers become Medicaid agencies. So it's a Medicaid agency orientation that a provider is required to pass before they move to the next level of an endorsement. And then each individual site that a provider is opening has to be licensed, and that requires walkthrough. That's for 24-hour residential. I believe it's for children's foster home. This pillar also works pretty closely with our background checks unit, with our Office of Training, Investigation, and Safety. So there are desk reviews that are done, audits on the financial side, in partnership with our Office of Program Integrity in Oregon Health Authority. So all of the above, I would say.
Thank you so much. We'll take one more question, then we'll jump into any recruitment, the process related questions then. What level of autonomy does this role have in setting priorities or initiating structural changes?
That is a very, very good question. I would say the level of autonomy really at this point depends on the experience of the individual who's going to be taking over this role, what sort of experience they have in operating a structure such as this. I lead in terms of, I'm not the smartest person in the room. I prefer to have people far smarter than I am in the room to advise on what should be done and what the best ways of doing things are. So but at the end of the day, ultimately the DD director is responsible for making all the decisions that impact the program. So it's a pretty close executive leadership team. We bounce ideas off of each other all the time. We talk about what issues we're hearing, how they need to be addressed, well, not how they need to be addressed, but who we need to pull in to get those things addressed. And also what areas we think that this might impact outside of just individual pillars. So it's a lot of that type of collaboration and partnership. Day-to-day operations, who's reporting to whom, et cetera, that is well within the autonomy of the leader of the pillar. but so much of what we do is also interconnected to other areas within the pillars or within the program that you can't really do a whole lot in isolation. But yeah, I think there's definitely room for a level of autonomy. And Darlene, being the last person who was permanently in this position a couple years ago, do you have anything to add? Or a position like this?
So I think mine would be, is there concern that there would be too much autonomy, or is there concern that there wouldn't be enough autonomy? I'm just put that out there because Dana has done a really good job of trying to bring in the different areas within ODDS. So we do, as an executive level team, work pretty closely together. And like she said, we do have conversations and bounce ideas off of each other. She's developed an atmosphere where people can reach out to any of us at any time. So it is important that while you autonomously can work within your pillar, also having an idea of other leads and the other work that's going on. So you can't just be marching down a road and not think about the impact it's going to have on other teams within ODDS, or maybe even ODHS or OHA. So I hope that helps.
Thank you, Dana. Thank you, Darlene. These were our questions so far, and I'll take if we have time, but we only have a couple minutes left. I want to share with our attendees today that the position closes June 30th midnight. There can be sometimes, workday glitches, some technical difficulties. If you have any difficulties uploading your application materials, please feel free to send those to me via email in Word or PDF format before the deadline. I'll be happy to upload those to your application for this role. And again, it's so very important that you look at the minimum qualifications and the essential attributes that we've posted within the job announcement. There was a question about APD experience. It does not matter. It's the IDD experience and the experience of supervisory and management experience. So if you go through that, it's important to highlight how you've attained those skills or through your professional experiences. So please make sure that you do that. Once the position closes, we'll be conducting our screening. So any updates, any invitations to interviews, or any just general communication about this role will be conducted through Workday. So please keep an eye out on your Workday accounts. So these are my just the updates about the recruitment process. With this, in the meanwhile, if you have any questions, feel free. I've put my email in the chat. Please feel free to email to me, and I'll be happy to help regarding that. I'll take one more question from the chat. Are there concerns if the applicant has persons utilizing ODDS services? I don't think so, but I would love leadership to jump in.
I agree with that. If I'm reading the question correctly, it means that the applicant knows someone or has family members, et cetera, utilizing ODDS services. That's not a concern. Of course, anytime there could be a potential conflict of interest, the employee is required to submit a conflict of interest form to HR, Human Resources, to determine if there's an actual or perceived conflict. So that would be the necessary process to do that. But often it's not an issue as long as the individual doesn't have control or oversight, et cetera, of the services that individual is receiving themselves.
Well, thank you so much, Dana, Darlene, and Amber, for being here and filling out with a wonderful informational session. And thank you for all attendees for being here. I will be sharing the recording within this week, along with other resources. But if you have any questions, feel free to please email me. And thank you, Melina, for being here. I appreciate you as well. Have a wonderful day, everyone.
Thank you all.